This is
Make It Plain.
Make It Plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make It Plain.
Get woke.
Ladies and gentlemen, what's the latest in terms of the White House's response to COVID, and especially within the equity context? My guest today currently serves as Senior Policy Advisor for Equity on the White House COVID-19 response team. He was an Assistant Professor of Medicine and Public Health Sciences and Director of Health Policy and Equity at the University of Virginia School of Medicine. He's a general internist. He's worked clinically in the University of Virginia's COVID unit since the beginning of the pandemic, and he is the founding director of the University of Virginia's Health Equity Law and Policy Research Laboratory, and is a core faculty member at the university's Equity Center, an initiative for the redress of inequity through community-engaged scholarship. Prior to joining the faculty, he spent a year as a 2016 White House Fellow in the Obama-Biden administration's Office of Cabinet Affairs, where he served on the My Brother's Keepers Task Force and the White House Healthcare Team. He's a native Virginian with his BA from the University of Virginia, his MD from Wake Forest, and his JD from Loyola University School of Law. We call that, the old folk call that, having as many degrees as a thermometer. He's got a JD in him. Very impressive. Dr. Cameron Webb joins us. Brother, good to see you. How are you, man?
I'm doing very well. Thanks for having me.
It's a pleasure to have you. I actually had last week Dr. Susan Gooden on at the Doug Wilder School, and she's dealing with their equity at VCU. So this is a good follow-up conversation. So we could almost just have a shout for the next few minutes about the fact that your title and this office actually exists. Because if it had gone another way in November, wouldn't even none of this be going on, would it?
Don't I know it? And so you mentioned in the in the start, I've worked on the front lines of this pandemic. I take care of patients, and I still do, even like on weekends when I'm not working in the White House. I'm taking care of patients at UVA, and I mean, this is so critical. We've known since this pandemic started the disproportionate impact on communities of color. You don't have to look that far to see it. And so knowing that President Biden put a premium on this kind of role, that Vice President Harris really saw as a piece of any kind of COVID response, I think that was critical. And being able to step in and say, listen, I'm just going to shoot it straight. This is what we need to do, and have folks who say, okay, if that's what we need to do to press for equity, let's do it. And that's the team that we've got right now.
So give us a kind of a state of equity report, if you would. How are we doing with equity? And I guess in the current moment, we're talking about equity, Dr. Webb, we're really talking about access to the vaccine, I presume, correct?
Well, to some extent, I think a lot of times that's what the conversation is centered around lately. And I think that's appropriate. The vaccine is our dose of hope, right? It's our way out of this pandemic for so many reasons. And so I understand why we're focusing on vaccines with regard to equity, but I don't want to lose sight of the fact that testing equity is critical, and access to the therapeutics to treat folks who have COVID, when disproportionately communities of color have been the ones having more cases of COVID, right? So we need access to those treatments. Those are all critical dynamics. Our schools being open because our kids are the ones being left behind. So all these are parts of the equity work. But when it comes to vaccines, I think that we are making a lot of progress. We looked at where we were in January 20th and where we are today. It's there's no question about it. We've made a ton of progress, narrowing gaps, getting more data in to tell us exactly what we need to see. Only 17 states were telling us the race and ethnicity of folks who are being vaccinated back on January 20th. That's 48 states at this point, 47 states plus the District of Columbia at this point. So a lot of progress, because you can't treat what you don't see, right? You have to be able to know what you're looking at. And then once we see those gaps, we've been laser focused, zooming in, working with those states, saying, well, what can we do to make progress? And across the board, every state now has an equity lead that I talk to every other week that we're connecting with, and we're hearing, what is it that the challenges you're facing? How can we marshal federal resources to support you to close gaps? Right now, the supply around COVID vaccines is to such a point that we've made a lot of progress. It's a demand dynamic now, and we have to make sure that people know that these vaccines are safe and effective. We can cut through the historic and present mistrust that exists for good reason, and tell folks, no, this is actually a pathway to success for our community. So still making progress. The numbers are improving every single day, but we're not quite there yet. So I still have a job for the time being.
More MIP after this message. So how are we doing in terms of getting the message to people that they're safe. We just had this scare with Johnson. I live in New York, and man, well, I'm sure you know. So it was announced yesterday. You go to Yankees and Mets game, you get a vaccine, you get a ticket into the game. You go to the subway now. It's about 10 subway stops now. They'll give you the Johnson and a 1-week pass on the subway. I mean, that's how much they're trying to move it. But people still, we had to scare with the Johnson. These all Johnson vaccines. People are a little nervous about that. What is your thought about that coming back online? And should people allay their fears?
Well, the way I think of it is this, I look at my family, and my mom is one of 10 kids. We got a big family, right? And my uncle, his name is Uncle Groove, believe it or not, but Uncle Groove got the Johnson & Johnson vaccine just last weekend because they were offering at a church near his house. I'm very happy that my uncle now has a life-saving vaccine, something that will protect him from the worst of what COVID can do. And I think that's what the Johnson & Johnson vaccine offers. The adverse events or the bad events, reporting system that we have for vaccines, it worked. It showed us that we had those, at the time, 6 cases out of 7.2 million. And that's why we paused it. This is a very good, very safe, very effective vaccine. And so I use the story of my uncle so that people know every ounce of my medical knowledge I use for the betterment of our society, sure, but also to make sure my family, my people are taken care of. And so I absolutely encourage my uncle to get that vaccine. I have other family members who've gotten Johnson & Johnson, and it's not because it's a lesser vaccine. It's because it could very well save their lives. And so I think that still remains true.
You mentioned some of the challenges you hear from some of the states when it comes to equity. Give us a glimpse of what those are. If people are having trouble getting to better equity or greater equity, what is the challenge beyond some of the apprehension?
Well, one of the main things is just that those barriers are just how this fits in your daily life. Asking somebody to step away, go somewhere to get vaccinated twice a week when they're a wage earner and every hour counts and they've got kids at home that they've got to watch out for, those are hard dynamics. And so to make that easier, the president announced the paid time off. So small and medium employers are, if you're going to get vaccinated, that's paid time off. If you are, having some side effects the next day, because some percentage of folks do have some fever, some feeling tired, some pain at the site where they got the injection. And if you have those symptoms, then you can stay home, and that's also paid time off. That is a huge barrier that we've removed for some folks. Today, the president just announced that transportation from Uber and Lyft, they're offering free rides to and from vaccination sites because that was a barrier. People, they're like, well, how do I get there? How do I get from there? Right. And so by eliminating those barriers, we're making it easier. And then we have our whole mobile units effort to bring vaccine to people. That's the real key, is that it's not just asking folks, make your way down to the such and such center. It's actually, how can we bring vaccines to your neighborhood, to your doorstep? And that's what we're working on doing now. So I think that's how we're removing barriers. And we're really, again, laser-like focused on doing just that.
More MIP after this message. Announced just this week, ready for children, correct? These vaccines are now going to the younger population. So you're comfortable with that?
Oh, absolutely. I mean, I think that the safety is not a question. And in fact, they found in that 12 to 15-year-old range, 100% prevention of even getting COVID, which was really exciting. So yeah, we want to protect our young people. We know that that ages 12 to 15, they're more likely to have symptoms that look more like adults. And so this is a really important age range to vaccinate. This is also an age range where folks want to get back to normal. And I think that, having folks get vaccinated, having young people get vaccinated is a part of our path back to normal. So, my kids are a little younger than that. They're 9 and they're 5, but my wife is an emergency doctor. We've already made the decision. When the vaccine becomes available for them at their respective age ranges, they're going to get vaccinated because we've done the deep research into the safety of these vaccines. And yes, we'll wait and see exactly what the safety looks like for their age range. But if it's similar to what it is for 12 to 15, which is why the FDA approved it for emergency use, and if it's similar to what it is for adults, then we're going to feel comfortable with that. Now, we still have to, of course, we'll see what the CDC says about it tomorrow. But for now, again, really, really excited. This is us moving in the direction of getting even more folks access.
I know we've got to go, but I have to ask you just one more. The doctor, should we prepare ourselves for boosters come the fall? Is that something that you've thought about or have any information on?
Well, one thing that this administration prides itself on is preparing for every possible eventuality. And of course, we're thinking about it. We're talking about what that would look like if we needed to do it. We're going to follow the science. And so if the science ends up telling us that's what we need to do, then we'll do it. But as of right now, we just don't have that information yet. We know that the vaccines last for some period of time, at least 6 months, likely much longer. And so we don't have the data that tells us we're going to need boosters. If we do get those data, if the science tells us that, then we'll respond accordingly.
Dr. Cameron Webb, folks, joining us from the White House. He's a senior policy advisor on the White House COVID-19 response team. This is what you can't have equity if you don't have diversity in these positions. This is what diversity looks like. So very proud of you, brother, that you're in this position and able to represent us and look out for our best interests. And we thank you for joining us on Make It Plain today, okay?
Thanks for having me. Y'all take care.
All right, you too. Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.